First of all, thank you guys. I was sharing earlier, I'm Debbie Durako. I'm the Senior Director of StellaLife. I was a dental assistant. I taught hygiene. I did lots of things in my career in dentistry, ran practices, did it. So I understand you all, and I know what you go through every day. So I'm here because Dr. Moody and your team saw something that they wanted you all to learn more about and have in your practice. So StellaLife is a natural product. It's made with some very interesting ingredients, and I want to share with you kind of the story behind it all, but also I love clinical. I love before and afters. You ever watch that on the videos where you're watching what they look like now when they got their hair cut? I love that kind of stuff too. In dentistry, I love before and afters as well because it's fascinating to me how wonderful the outcomes can be when you look at innovation and how innovation has changed things. So it all started, took 14 years to develop the product. It's made all out of plants and minerals. It also has a long shelf life, about 2 years from manufacturing date to the day that it dies. And it all began as a pain reliever. Our original goal was to reduce opioids in dentistry. And when we were in that process of learning how to do that, we found all these other applications that it was working for. And that's how StellaLife became created. So it is really intelligent healing at its finest. You'll notice that it does several things. It relieves pain naturally by controlling inflammation. You know how when your patients have surgery, what's the worst part about it? 24 hours later, they have lots of swelling. Well, when they use our recovery kit, 3 days before, all 3 products, 3 times a day, what happens is you've prepared the tissues prior to surgery. You've lowered and become an antimicrobial. You're decreasing swelling and bruising, and you're also promoting wellness because you're getting your patients to a state of where they can actually have a low microbial count of the bad guys in the oral cavity prior to surgery, and those tissues are saturated with anti-inflammatories naturally prior to surgery. So when you dive in, the doctors are diving into an amazing environment, a really healthy environment to do surgery in. So my case studies you're going to love because it really is quite interesting how you can do this with plants and minerals. So we did that, and with that focus in mind. And then I think it's also, before we start looking at some of the case studies, clinical case studies, you understand the science behind it. So our products went through some vigorous research in science, and if you all know Dr. Rick Myron, he is amazing. If you ever have a chance to hear him, he's a fantastic lecturer and a really brilliant scientist. He was one of the first to test our product against chlorhexidine. And what he found was that not only were we far superior to chlorhexidine in cellular biocompatibility, we also did not kill fibroblasts. And by not killing fibroblasts, you're allowing the wound healing process to continue, but also we can accelerate it because they love it. They just love it. And they start moving the collagen faster and faster. So earlier I was talking about how this is so interesting to me. I'm kind of nerdy when it comes to the science. This study came out of San Antonio. Dr. Georgios Koutskis actually did this study comparing what you'll see here is the control, and this is salt water, this is Listerine, this is chlorhexidine, and this is StellaLife. What you're looking at is, through a microscope, fibroblasts. And here's what salt water does. Doesn't kill them all off. Not too shabby, right? Wow. But look what Listerine does. It kills over half of them. So you do not want your patients using Listerine, particularly after surgery. You want fibroblasts to live, to thrive. Here's chlorhexidine, wipes them all out, pretty much down to 0. And here's StellaLife. Not only do they stay alive, they thrive, they love it, and they continuously move the collagen fibers to close the wound. Here's salt water, these are fibroblasts. Here's chlorhexidine, no activity, and here you see the little fibroblasts coming out and closing the wound rapidly. So that's why you'll see a different approach to your patients when they come in. And the other study that we published came out of Indiana University, found exactly the same thing. comparing it to other products, that this was far superior to its ability to help you heal faster. We know a lot about chlorhexidine. We've been using it for years, and we have had a lot of studies on chlorhexidine. Unfortunately, the part we don't like about it are the side effects. There are a lot of them. You can have patients that have altered taste. It can raise blood pressure, but most importantly to the patient, it stains their teeth, and they don't like that, which means they'll stop using it. So we wanted to find an alternative, and that's what we've done with our Vega Oral Care. So the other thing I wanted to share with you is something new that is exciting to learn about. This is frontier science. Vitamin D deficiency is becoming something very, very talked about in our world of dentistry, because we're seeing in certain studies 300 times more incidences of implant failure because the patient had low D going into the procedure, and vitamin D is very important to be able to help build bone. So what we've done also is we have created in joint effort a product that actually can support your patient prior to and post-operatively with a vitamin D supplementation that's actually really more than just D. It has all the essential nutrients and things that it really needs to be able to help your body create this D that you need so desperately. The other thing that we've created, and the science behind it, is a oral and gut probiotic. These are the things that are brand new to us in dentistry. And what we're seeing is that, think about the logic behind this. What's the root cause of periodontal disease? What's the root cause of people losing bone, losing teeth? There's a root cause. We know that bacteria that is very destructive, like Strep mutans and P. gingivalis, are known to create these issues for these patients. So you're seeing groups of patients now that are coming in and asking for help. They want to restore their oral cavity to form and function and beauty again. And so to do that, we really need to understand the root cause of why they got there, right? So what we're thinking is that if you treat the gut and the oral cavity at the same time, particularly with perio patients, that you are replenishing all of the good bacteria back in the gut and the oral cavity at the same time, overcoming your Strep mutans and your P. gingivalis. The more good bacteria you have to fight them, they can overcome them. These patients are usually high-risk patients from a medical standpoint anyway. So we can do that now with oral and gut probiotic. And you know what's interesting is that it has some really intriguing side effects as well. With stomach acid issues and things like that, it can really help in so many different ways. So let's talk about the surgical applications here, because there are a lot. Not only surgery, but also mucocutaneous diseases in perio patients. So I'd like to share with you, this is Dr. Pico's, and he's going to show you what this 333 program is like, possibly here. Let's see if this is going to play.
There's a 333 regimen we talked about. It's very impressive. Here's a typical V-plasty with Eloderm. Time 0, there's 5 minutes. Hemostasis is like boom, amazing. But keep gauze on it for a good 4 minutes by the clock. That's the key to a little compression and let it soak in, and bingo. Here's a case of just cytoplast over extraction sites. You know, again, tissue is beautiful, response is very, very nice. And then here's our typical, 48 hours later, that's what things look like. Very typical.
Beautiful, isn't it? That's 48 hours after a major surgery. And that again has a lot to do with the preemptive preparation of the tissue. The best results come from using this recovery kit that has all 3 products in it. All the instructions are on the side, easy to see for the patient, and they use it 3 days before, all 3 products 3 times a day. So they rinse, they spray, and they apply the gel to the site where the surgery, and that could be anywhere or all the areas. And they do that in preparation, and they continue doing that after. And this is what you should see. 40 minutes after, and all on 6, it looks like that. The other thing I wanted to share with you from a clinical standpoint is rapid wound healing. And then I promise we'll talk about perio, because I know we all have our interest in where it lies for all of us. So here's an example of an impacted canine. You have the bone product being placed. This is 7 days post-op wound healing. So for my hygienist and everybody who loves pretty pink tissue, look at this. I mean, this has been working everywhere, not just site-specific, but everywhere. So you have a patient who has over 12 days of low microbial rates, anti-inflammatories going on, and being able to heal all over, not just one particular area. And then here's your comparison side by side to chlorhexidine versus StellaLife. Can you see the difference? That's at the same time point. One side, StellaLife, is almost in complete wound healing. You see how the tissues look, not swollen, not red, but look at this. Every puffy tissue, all that shiny, you see that swollen tissue, still in the wound healing process. And because we know more now than we ever have about what chlorhexidine does to fibroblasts. And last surgery case I'll show you is just a split mouth that shows one side with StellaLife, the other side that traditional model of care at 40 minutes. So you guys do surgeries like this every day. So this is the advantage of being able to help your patients less pain medication. Remember, that was our goal from the very beginning, is to control their pain. When you control inflammation, you control pain. So these are the kind of patients that don't need 10 Vicodin. They get 1. Dr. Picos talks about this. You get 1, you break it in half. You take half tonight, you get the other half in the morning, and you better not call me. He's so funny when he says that. But it's true. They don't need that any longer. They can use acetaminophen Motrin combo, which is excellent, and tons of studies on that as well. So this is how you guys would apply it. Chair side, right after a case. This is using a Q-tip application. So after, what you want to do is, if I can get this to run for you, there we go. You just use a Q-tip, put a little bit of the gel on the chair side, and then you'll see how you can apply it.
With immediate temporization, we're going to
right in the wound
right after the surgery,
with the gel. Just all over.
Side,
put the gel everywhere you feel it's necessary.
We bring the patient back 15 minutes later for delivery of the temporary prosthesis. You can see the tissues already
That's
responding
15
quite
minutes
nicely.
later.
You can see the nice and pink color there, and very minimal bleeding. The patient's going to continue with StellaLife recovery kit for the next week, and then when we bring the patient back in a week for post-operative appointment, we're going to evaluate the soft tissue.
And now you'll see what this looks like.
And where we're looking at the soft tissue,
At 1
a
week.
week later, you can see
Look
the
at
tissue's
that.
already expanding
Beautiful,
very, very nicely.
clean, healthy looking tissue. So this is what our goal is, as well as controlling pain management. Now I talked a little bit about the acetaminophen Motrin combo, and we were published on the ability to reduce the opioids in this dental practice, the surgical practice. Back in 17, over 75%. Now it's like up to 90 something. He hardly ever has to give very much pain medication, like a narcotic like that. And the other study that was published on pain management you can find as well by Dr. Suzuki and Dr. Cameron Lee on bone blocks. So that's surgery. So let's talk about stuff that people ask you all the time. Abscess ulcers, people get them. There's a reason. We really think too that the oral and gut probiotic will really help these patients a lot, because there's some reason, right, why they're getting them. So using our rinses long term can really help. And this study was done by Scott Fromm, and he actually had patients receive laser treatment. A group got Magic Mouth Rinse, and another group got StellaLife Gel. And when he compared the wound healing, the group with laser and Magic Mouth Rinse took about 10 to 14 days to heal. But StellaLife Gel patients 2 to 3 days. So do you use lasers here?
We will in the future, but not now.
So when you use lasers, you can actually use lasers and gel right after and send them home with the gel. There's nothing better, especially when you're in pain and you can't swallow and eat. The gel is very soothing. It does not feel burning or anything. It actually feels very good on the tissue. So Scott Fromm did that, as well as he took a look at an interesting topic is antibiotic therapy in the periodontal patient. So he said, why don't we test a bunch of saliva on perio patients that we know are going to need scaling and root planing. And what he did was he got the test, knew the bacteria that was in there, and all he did was he put them on this recovery kit. They didn't get scaling or root planing or prophies. And he put them on the kit, said use these products, and then we're going to retest your saliva in 10 days. I want to see what happens under the microscope. He knew they're still going to need perio scaling and root planing. We weren't eliminating that, but he wanted to see. There was a 22% reduction in bacterial colonization just by using that. So think about your patients that are coming to see you. They're investing in their care. You want it to be successful and you want it to be long-term. They need good rinses. They need good products to be able to do that. And that's what we're seeing. We've also been tested, I mentioned earlier, for 3 strains of that crazy COVID-19 and human coronavirus derivatives. And we killed 3 strains of that you see up here that are the root cause of things like COVID-19. So we know we can also be an antiviral. And here's the drum roll for my hygienists in the room. So this is how you use it in scaling and root planing. You want to irrigate and get just a little 3M syringe, fill it with some rinse and irrigate. And then you want to apply the gel after root planing and scaling around the margins. And you send the patients home either with recovery kits or rinse and gels. And that's the risk factor of the patient. They're diabetics, they're hard to treat, they're hard to heal. You've got to give them the big guns, which I call it, which are the recovery kits. So you keep them on that for the next 7, 10, 14 days that they're in treatment. Once they're done with active treatment, they just use the rinse every day, twice a day. So they can use it as a maintenance protocol. If they get a flare-up, they go right back, apply the gel at the site. It's incredibly healthy for them. And it's also a wonderful long-term antimicrobial that it really encourages these patients to be able to heal and stay in remission from their periodontal disease. The other thing we talked about earlier was dry mouth. You guys got lots of that. And everyone does. And so we're going to see a lot of problems with restorative care because we have so many patients with dry mouth. This has xylitol in it, which is going to be your moisturizer, but remember, we're killing strep mutans. So decay rates should significantly be interesting. After you use this, they should decrease because you don't have the source, which is the strep mutans. So use it for dry mouth patients. They can use it every day. And here's my favorite clinical slides. These are the hard to treat patients. You see lichen planus ever in the practice? So this is lichen planus 1 week using rinse and gel. We guarantee all these products for the patient as well as the offices. If it doesn't help them, please let us know, we'll replace the product. These are hard to treat cases. They're difficult. And so here you have lichen planus and then mucositis. So mucositis is also a side effect of chemotherapy and radiation. You may see patients that have gone through that and they need restorative care after. Recovery kits have been significant in helping them reduce the side effects, and in some offices, it's prevented mucositis for these patients. So try it, and the coconut rinse is even better for them. Our kits only come right now with peppermint in it, but try the coconut with them. It's so soothing, and it has more ingredients to help soothe. So I mentioned earlier also about why we should look at the gut and why we should look at the oral cavity simultaneously. Again, going back to what I first mentioned, there's a reason for all of this destruction. So if we treat the gut with good flora and we treat the oral cavity at the same time, we're giving these patients back stuff that they need that antibiotics destroy. So you need a probiotic right away. And they also have very weak immune systems, so they can't even fight what they have. So you give it back to them by giving them a great oral and gut probiotic. And then you also know that these particular strains are very important to know. There's a reason for these. They're all focused towards what we need in dentistry, but they also, we use something very important, a spore. You can't go and just purchase oral and gut probiotics and expect to get the same thing from every probiotic and prebiotic. So what we did is we used a spore that lasts longer in the stomach acids. We also added, on top of that, we did a pre and post, which means they're getting food to feed the little guys, and they're also keeping them alive with the pro. The reason why the minerals and everything are in it that helps disperse it, he keeps them alive longer. So it's a very important piece of the puzzle to do that when you're taking an oral and gut probiotic. And by the way, I'm leaving you some. You can fight over them. If you want to try them, you can. And they taste good. The lozenge tastes good. You just put it in and let it sit there. You swallow the spore, put the little lozenge in, and just let it float around and dissolve on its own. You're dispersing billions of good bacteria in your oral cavity. And there's tons of science that I can always send everybody on. And then also with Dentamedica, this is really important as well. I mentioned earlier about patients that are having implant failure, but they're not smokers. They're doing everything right. The bone didn't integrate properly. We're discovering that there's a need for vitamin D protocols, but this is different, like everything we do. We added several things to it that was super important. If you don't have K2, if you don't have E, if you don't have the B complex, you don't have selenium and copper and magnesium at the levels you should have in your body, you don't absorb very little of the vitamin D. So we put it all in there. So then it's one thing patients can do. They take it in the morning and at nighttime. And that builds up that vitamin D back and allows them to have the amount that they're supposed to have. Very large deficiency. Even in your beautiful sunny area, we're inside all the time. And you're not getting the D that you need from the sun. So I'll leave some of that for you too. And then I think it's also just important to understand that this has been tested in a lot of different ways. We've had Gordon Christensen review our products with high accolades. We've actually been the top wound healing for several years in a row with Dental Advisor. So a lot of doctors, a lot of clinicians have put their eyeballs on this, tested it, and said, this is doing exactly what you said it was going to do. And how I met Dr. Moody was through colleagues, but also through just so many courses now are teaching this as part of the standard of care for your patients that are going through these surgeries. So when we originally sent our trial package to you, there's clinicians' guides, they're laminated. We'll get more of those to you, and they have all the instructions like this. Very easy to follow, and we have pamphlets for your patients as well. It really can be interesting to watch what happens when you use products like this. Patients tend to do more dentistry. They have better results. They have better pain management. They give you better Google reviews. So that helps everyone and helps your business as well. The other thing we'll do is we will put you on Find Provider. When we started our company, we really wanted to make sure we were more than just products. We wanted to help you. So what we did was we created a tab on our website. If somebody calls us, what we do is we send them there. They put their zip code in, and your name will show up right on the side, along with a neat little tool called Schedule Widget. The purpley thing on the screen is called Schedule Widget. They can click on it and call you, or email you, or text you, whatever you choose. So it's helping you grow your practices. And lastly, just very quickly, this is just some of your leadership, some of your doctors across the country that have been using this for a while, and how they feel about StellaLife and what it's done and made a difference in their practice. So let's see if we can do this.
People's lives by accelerating healing, relieving pain, and reducing the need for opioids and steroids.
I can tell you that across the board, it's been an amazing experience for all of us, for my staff, certainly for me, and most importantly for our patients, because the feedback has been tremendous.
I've done over 150 cases and photo documented them. The healing in 1 week looks like 4 weeks.
We've been able to reduce the number of opioids that we prescribe in our practice almost fourfold in the last 3 years.
In the past, I would see wounds opening up, I would see membranes not only exposed but being lost, I would see bone grafts being lost, and can't say I would always attribute that to the chlorhexidine, but the use of the oral care program has just been really spectacular, and I love the overall root canal that I'm seeing.
Well, my assistants came to me and said, let's use this for every patient. Why? Because we're prescribing a lot less pain medication as a result.
It was a pure miracle. The difference in night and day in waking up without dry mouth.
Oh, this is the best product that I've ever had. I have a cancer patient with melanoidosis that is on chemotherapy. It's the only thing that allows her to eat.
We could not imagine practicing without StellaLife in our practice today.
So there you have it, everybody. That's a lot of information to get at you very quickly. But I wanted to make sure I answered any of your questions. If you would like to try the rinse, I know you've all had lunch, so if you'd like to try the rinse, I brought some cups. Anybody have an abscess ulcer? Anybody have any little cheek bites or anything? Gel is here for you. I'm leaving everything for you guys. So I want you all to have an opportunity to try the products, to taste it. It actually tastes really good. And give yourself an opportunity to experience it. And I think you'll agree once you try it, it's very pleasant. And it helps your patients be more committed to their care because they like it. So I want to thank you all. Do you have questions? Anybody have anything? Yeah.
Yeah, so I heard you mention like it was soothing to the patient. Is there like, I know you said you wanted to have them like about 3 times per day they take it. Is there a max amount of times if it's soothing and they like it that like they should go more than this many times?
That's a great question. And we haven't found that it's toxic at any level. So most often 3 to 4 times a day is usually enough because it lasts long enough and we want it to last as long as it can for them. So absolutely, they can use it 3-4 times a day. I have some dry mouth patients that are using our rinse multiple times a day.
Okay.
Unfortunately, dry mouth is a big problem, and you know the root cause. Again, going back to that, it's really hard to discern with some of these patients where it's coming from, but they can use it multiple times a day too. It's a good question.